So in this registry study, which is led by Dr. Manos Prolakis, and we're a participating center at Mass General, we had investigated the effects of multiple CTO, chronic total occlusions, to be done in the same setting versus our typical single CTO approach. And the reason we did this study is that often when we have patients who come in with chronic total occlusions, many of those patients will have a second occlusion, especially in the post-bypass situation. And they can contribute to symptoms and ischemia, and so often we consider complete revascularization and taking care of multiple CTOs or all really significant lesions during a revascularization procedure. Now, chronic total occlusions are complex. They take more time. There is more experience needed. The complication rates are higher than non-CTO PCI. So an open question is whether or not we can safely and efficiently do multiple CTO PCIs in the same setting. And this observational study, this observational registry looked at that population. Out of about 2,000 patients, about 2% were studied to actually find procedures where multiple CTO PCIs were performed. And in that subgroup, which is 2%, so about 50 patients, not huge numbers, what we found was that, in fact, the complication rates and success rates were impaired compared to just doing a single CTO PCI. Now, this is hypothesis generating. There are sometimes practically where patients are not able to come back to the center. There are times where the vascular access complication rates would be higher for a repeat attempt. Sometimes these patients are being done on mechanical support. So because these, again, are not randomized data, we don't have full assessment for bias that could be in these data sets. But the general concepts that we found, that there was more radiation, there was more contrast use, does make one pause when thinking about doing multiple CTOs in the same setting. That one, I think, would be more apt to stage. That I think is that concept is spreading throughout the CTO community. And that is just to avoid an unnecessary stress physically on these patients and potentially compromise what is a really excellent single CTO result.